Good evening and welcome to Conversations About Autism, Managing Sleep Challenges. Our live stream will begin shortly.
Greetings and welcome to Conversations About Autism. My name is Jennifer Mannheim and I am the host for this broadcast of Conversations About Autism. The topic of discussion is managing sleep challenges. Before our participants introduce themselves, I want to invite you, the person watching this broadcast, to share with us your thoughts tonight, either in the live chat or by completing a survey at the end. And we are always looking for new topics to discuss. So if you have an idea, please share it with us. This broadcast, as I mentioned, is about sleep challenges, specifically for individuals with autism, and an important topic because, well, sleep has an impact on our everyday lives. So I want to introduce our participants. Let's see if we can bring them on here. Excellent. They're here. They're all coming on. And I'm going to have them introduce themselves. I will start. We've got some background noise here. I'm not real sure where it's coming from, but I'll start off by mentioning, as I said, my name is Jennifer Mannheim, and I'm a nurse practitioner at the Autism Center, which is where I'm logging in from right now. My role at the Autism Center is that I diagnose and support autistic children and their families. And I was thinking tonight we could also share maybe one thing we do, or more if you want, to help us fall asleep at night. And I'd say I usually try and imagine my dream garden, and I try and hold as much of it in my mind as I can, like all the details of it, until I fall asleep. And it works most nights, not every night, but that's what I do. And so I think next we're going to go to Dr. Chen. Do you mind introducing yourself, your role at Children's, and what you do to help yourself fall asleep?
Thank you so much for having me here tonight. My name is Madia Chen. I'm a physician here at Seattle Children's. I have been here since 2005. I am a pediatric pulmonologist and a pediatric sleep medicine physician, and I'm the director of the sleep center here. So I've seen a lot of children who have both autism and sleep challenges, and happy to be here tonight and interested in the discussion that's going to happen. Things that I do to sleep. I do two things pretty regularly. One is I try to really exercise at least like 20 minutes. It doesn't have to be like a very hard thing, but I just find that if I do something to move my body, I tend to sleep better at night. And if I'm having some trouble falling asleep, I do very, very easy crossword puzzles. The kind that you buy at the airport for like $2 on the really thin recycled paper that are like in jumbo print. They say easy on them. I do those. It helps me get tired and fall asleep.
Excellent. Those are both great tips. Well, welcome, Dr. Chen. And next I have Sage. Can you tell us about yourself and what helps you fall asleep at night?
Hello, everyone. My name is Sage Davis. I'm an autistic self-advocate and a Master's of Social Work student at the University of Washington. And I have a pretty elaborate bedtime routine, but I think one of the most important parts is taking a warm shower before bed. So that really helps me get in the mindset of sleep.
Excellent. That sounds fantastic. Well, welcome, Sage. I'm glad you're able to join us tonight. And Khadija, can you tell us about yourself and your daughter, and then what helps you guys fall asleep at night?
My name is Khadija Ahmed, and I have autistic daughter. Her name is Samia. And what is work for me in nighttime, I try to walk afternoon.
Ah, excellent.
Yeah.
And does Samia have something that you think you do for her, or that you think helps her fall asleep?
Usually, most of the time, she will go together.
Ah, okay.
We work together the afternoon.
Excellent. Those walks. So it sounds like exercise, at least 2 out of 4. That's definitely an important part of a sleep routine.
Yeah.
Excellent. All right. Well, to start this conversation, I'd like for Dr. Chen to tell us about the most common sleep problems you see in the sleep clinic, and if maybe there's some that are more common for people with autism.
Yeah. When sleep clinics started here, it was largely to evaluate children who had something called obstructive sleep apnea, which is a condition where you have pauses in breathing, wakes you up, you don't feel so good the next day. But really, over the last 10 years, I would say that the most common thing we see in sleep clinic now is some form of insomnia. So insomnia is where you have difficulty either falling asleep at the beginning of the night or staying asleep through the night, or it can be both. And we see a lot of insomnia, both in children with and without autism. I would say it became really, really problematic during the pandemic. And it's clearly related to mental health, not necessarily for everybody, but I would say as a general statement, I think as mental health has really struggled for our children in the last several years, so has sleep and insomnia. And so that is by far the most common thing that we see in clinic now.
Excellent. Yes. So many of the patients who are referred to you are referred because they're having a hard time falling asleep or staying asleep. And then what do you guys normally do when you see them at the sleep clinic?
Well, I think important to know is that it's never really a magic bullet. I wish it was, but it's really not. We spend a lot of time gathering information at the beginning, really trying to figure out people's routines and patterns and helping families. Sometimes families have so much going on. If parents are working, if, the kids are busy in school activities or whatnot, a lot of times families have some difficulties recognizing the patterns of what are happening in the daytimes and evenings. And so we spend a lot of times just trying to sort through some of the things that are leading to or associated with difficulty falling asleep. Spend a lot of time on things like bedtime routine, just finding out what's happening. We do try to do a lot of education with our families and trying to tell them or help them anyway, sort of optimize sleep for the whole family, right? It's not just the patient ever. It is really the whole family that needs to be involved. Sometimes we will do something called sleep studies. Sleep studies are an overnight experience where the patient is hooked up to a lot of sensors, no blood involved, no needles involved or anything like that. But it allows us to look at how frequently they're waking up, what their body is doing, what their brain is doing, what their breathing is doing during sleep. And it helps us to be able to put together a whole picture of what is happening overnight so that we can start to work on some solutions.
Excellent. And what ages do you guys see in your clinic?
We see newborns through 18, really. We have a handful of young adults who sort of have graduated into the program with us, but in general, we see from newborn through 18.
Excellent. All right. Well, thank you, Dr. Chen. We're going to come back to you later on with some more questions. And those who are listening tonight, you've got your opportunity to ask some sleep questions from the sleep doctor. So please feel free to put those in the chat. But next, I'm going to go to Sage. And I know you've had some personal experience with sleep challenges, even starting at a very early age. Do you mind sharing the nickname your parents gave you when you were little and how you got it?
So when I was a baby, my dad started calling me little baby no sleep because, as you might assume, I didn't like to go to sleep. I didn't like to take naps. And so, pretty much from infancy, I was just not somebody who goes to bed very easily. Yeah, and so my parents had to get real creative with coming up with bedtime routines and things to help me, be able to get more sleep.
Yeah. Can you remember or like share with us some of the things that they did to help you sleep? I remember you were telling me a little bit, one thing your dad did in particular.
Yeah, when they were trying to establish like a bedtime routine, the way that my dad would get me to like start getting ready for bed, because I didn't want to go start brushing my teeth and things like that. He would race me to the bathroom, and so he'd be like, whoever gets there first wins, and I like to win. I'm competitive. So I couldn't let him win, even though I was like, I really don't want to brush my teeth, but more than that, I don't want my dad to win this race. So, and it worked for years. I was like, okay, then I would be in the bathroom and I'd be like, all right, well, now I'll brush my teeth, I guess. So being, like I said, being creative, being willing to get kind of silly with it helped a lot.
Oh, that's awesome. Thanks. And we'll definitely come back to you in a bit here because I want you to share some more like how's your sleep has evolved over the years from the time that you were a little baby no sleep. But next I'd like to go to Khadija. And I know your daughter started having sleep trouble when she was 2 years old and ended up needing to have her tonsils and her adenoids removed. After which she slept pretty well until she started school. Is that right? Do you mind telling us a little bit about what happened when she started school?
Like her sleep, getting like she don't sleep at nighttime. Like she cry middle of the night. Like she goes sleep, but she wake up middle of the night. And I try to like put her to sleep back, and she doesn't. She cry like in the morning. Then when she go to school, then because like she didn't have enough sleep in the nighttime, then she cry. Then she have to call me from work and say like, what happened to Samia? Like she doesn't listen. Like she crying. And that's then when I figured it out. It's not something I can do in my end. I try to like afternoon make her like tired. So I take her when I get off work afternoon. I pick up the daycare. I take her to the walk to the playground so she can get tired. I give her a shower, and I put her to bed when she eat dinner. In middle of the night, like she wake up like it's like when you drown in water. Though I put 2 pillows in the elevator in her head, like she wake up like that. And I didn't know any experience for sleep apnea. Though I have it, but I didn't know what it was. So I go to her doctor and I said, like, I don't know what's going on. Like she doesn't sleep. She cry all night. Like she can't even breathe right. So they send me to children hospital. So they put camera in her throat so they can see what's going on. And they told me like we have to shape what is the voice cord so then she can breathe. It helping her that way. So when I hear the surgery and I hear the voice cord, it's like because she didn't speak until she was 5 years old. So by that time, like she started using words. So I say, like, I don't want to go back. I mean, I want to go back what she was a couple of years. No, I need other solution. And they said, this is the solution. I say, no, I have the other solution somehow. I'm not doing, no, nobody's touching her throat. So then they send me, they say, okay, I have to go back to the doctor. I talk to her. I tell her like the options I have, what the doctor told me and what I don't want they do. And he told me, okay, we have to see if she has sleep apnea. I say, okay. So they send me to children's hospital. They keep her overnight, put her all these wires in her head. And we come back in the morning at home. They make a follow-up appointment. Like, see the doctor. Up till now, she see the doctor twice in a year. And then they explain to me she has a sleep apnea. So I think she benefit if she get the machine. and she got the machine. Her sleep is got better. Before she got the machine, the doctor prescribed for her medication. She was taking melatonin, and she was taking trazodone. But though she taking that medication, it wasn't helping her before the machine. She still wake up in the middle of the night. But when she got the machine, she got rest. It is not only her. I got rest. My brain didn't work because I work all night and in the morning because I was single mother. So I working all day, like 9 hours a day. And I woke up all night. So it wasn't only her, like it's affected both of us. But when she got the machine, because Samia, she doesn't like to try new things. If it's food, if it's people, if it's new places, anything new, it takes her a long time to get used to. So I got the machine and I have the mask, the cushion. So I told her, explain to her, oh, she liked this store. She doesn't buy anything, but she loved to go. Up to now, she was like 15. Winko. It's her favorite store. So I told Samia, if you let this mask sit in your mouth, maybe 5 minutes, I take you, Winko. And she said, okay, Mom. I put her the cartoon she liked in the TV, let her sit. Then I was adding it every day, like 10 more minutes, 20 more minutes. When I see like she be comfortable a little bit, the mask, then I try to use the machine in nighttime. As soon as the air hit her nose, she yanked. So I told her, and tomorrow morning, we're going to your favorite store. If you let her 10 minutes, you're 10 minutes away. See, I'm going to set up my phone. When my phone will go off, I'm going to take it off. She said, okay. So I take her the pillow, lay her down in my lap to the bed and wait. So I added. Some nights she doesn't want to touch it even. It was a long time, but it worked it in the end. I didn't give up. Because I see this thing is benefit for her and it benefit me too. Even the teachers, like when she got used to in like, at least she went like maybe 2-3 hours at nighttime, they can see it improvement in a school even. Like she play with the kids, like she's just listen to the teacher and say, they called me and said, Khadija, what is going on? What Samia, she's like literally is changing. And I explained to her what happened. She's happy kid. But when your brain is don't sleep, then you're not happy. Either you are adult or child is the same. So now she has longer time. The machine, she's getting better. She uses every night. She does her own. I don't have to remind her. She eat dinner, she brush her teeth. In the morning when she wake up, she check the chamber, dump the water, rinse, and let her sit in the counter all day when she's not home. When she come back nighttime, brush her teeth, eat the dinner. She put water. Every Wednesday, she knows the day I clean her machine. So she come back school early. She has this packet. We have to let her sit water and baby shampoo to a couple hours. She said, Mom, today's my machine day. It's like, okay, bring. So I'm glad. It was frustrating first, but it worked it in the end. And each parent has a problem. My advice is it is not, I know it's not easy. It is not something fix it in a week, fix it in 2 weeks, 3 weeks. It's something you have to take time and patience, but it's gonna work in the end. It's gonna work in the end. I was frustrating. I was like, this thing the doctor give it to me, it's not working, but I was like, something hold me back and say, no, try more again, Khadija, try more again. And I'm glad I did.
Khadija, your story is amazing. I just have to chime in there and say that. And like, what an amazing advocate you are for Samia. Knowing something's not right, taking her to doctor's appointments, going to more doctor's appointments, hearing some treatment that you were worried about and you spoke up about it, that you were concerned because, you know, she didn't start speaking until she was 5 and you were worried that a procedure might impact her. And what else can we do? You tried medications and supplements like melatonin and triazidone. And then you're given this machine, which I'm going to ask Dr. Chen to tell us a little bit about that machine here in a minute. But I know it's a really hard thing to do, and you did it. I know a lot of people struggle with adults struggle with that. So like the fact that you persisted, and I'd say the one thing about individuals with autism is that once they can get a routine going, they are really good about sticking with routines. So it sounds like you were able to do that for her. And I just have to remark and say that you are amazing advocate. And I'm so glad you could come here tonight and share that story because that's hard. That's a hard thing as a parent, right? So as a parent experiencing that and you're not sleeping and you're having to leave work to pick her up because she's struggling and go to all these appointments and all of that. So it's well done.
Khadija, I would just say, I would echo that. It is so very, I mean, obviously from my standpoint, so very heartwarming to hear about these success stories. I think the machine that you're referring to is CPAP. Is that correct?
Yeah. Yes, it's CPAP.
So CPAP stands for continuous positive airway pressure. And what it does is it's kind of like she was explaining, it's a small little machine. It connects with a hose to a mask. And through that, then it delivers a column of air, kind of like a fan, think of it that way. And that fan blows air into nose and mouth sometimes, or just nose, depending on the kind of mask. And that air then pushes open the sides of your airway to keep them open. Fancy sort of terminology, pneumatic stent is one way of doing it, but essentially just think of like those wiggly wobbly guys that need the fan to blow up, that kind of thing. And so basically this fan or CPAP then keeps the airway open, and then your airway does not block or it doesn't obstruct. And so then you can breathe. And so for people who have obstructive sleep apnea, it can make a huge difference in their quality of sleep because they are not being constantly woken up from not being able to breathe. We know CPAP though is super challenging. I mean, I think an optimistic estimate would be that 40 to 50% of kids ever learn to tolerate it. I think it's actually much lower in individuals with autism because many of them, it's super easy to get frustrated with it, right? And Khadija, I think your persistence is amazing in that sense, just little by little. But, individuals with autism, they want to succeed. And Sage, you're competitive, but it's not even so much a competitive thing. It's just everybody wants to be good at something. They don't want to go to bed and feel bad. They don't want to go to bed and fail at falling asleep or fail at breathing. And so once you establish the success with it, it's easy to replicate success. It is very frustrating to replicate failure. And so I think when families, caregivers, guardians, when they see that it is a battle or don't have the patience or the bandwidth or just don't see what that benefit is, it's very easy to give up on CPAP. But yours is a true success story in that sense. So good for you and Samia, really.
Thank you.
Yes. Dr. Chen, I've got you next as a question I wanted to ask for those parents who are watching tonight or later on this video. If they have concerns about their child's sleep, could you give them some advice as to where to start and what to think about?
Yeah, I think before sort of problem solving and solution jumping and trying to fix something is really taking the time to gather data. It's super helpful. And so we ask people to fill out sleep diaries and figure out like, what time do you usually go to sleep? What time are, if your kid is having awakenings, what time do those awakenings happen? It is actually pretty rare for kids to have awakenings at a true random pattern. Most kids who have like issues with awakenings or insomnia, there's a pattern to what time they wake up, or what time they eventually will fall asleep, that kind of thing. And so it's hard for sleep deprived parents to remember anything, right? And so I can't tell you what I ate for breakfast. I don't even know if I had breakfast today. And so when we see families in clinic, to ask them, okay, what does your kid normally do? Really, they usually only tell us what's happened in the last day or two, or super bad experiences that happened when you were an infant and you were a baby no sleep. Like, they'll tell us about that, but I'm like, I need to know the last week, 2 weeks, 3 weeks. And so writing it down on a daily basis as it's happening is some of the most important information and really valuable information there, because the answer is in there, right? Like, if we can figure out the pattern, we can start to really more effectively troubleshoot. And so I would say if your child is having problems, the first thing is to actually record what is happening over a couple weeks' time. It's the best investment you can make in that sense. Beyond that, I think that there are some general good, what we call sleep hygiene tips in terms of the environment in which your child is sleeping. The biggest one we all struggle with right now is media, screen time. Everybody has an electronic device. And I feel like its use is actually higher in children with autism than not, because the phone can be a pretty good babysitter. I think, especially if you are a very tired working parent and you just need some downtime. But we know that screens, not so much just the fact that they're watching it and not doing something else, but the light from it, the content from it, can be really stimulating and really disrupt the onset and maintenance of sleep. And so trying to even get the whole family off media for 30, 60 minutes before desired bedtime is one of the best things that everybody can do across the board. And then, some common simple things, but dark room, a cool room, your body actually cools down during sleep. And if it isn't allowed to cool down, you actually don't sustain sleep for as long. So dark, cool room. White noise is actually a great, simple trick that helps many people. And it doesn't have to be a fancy app on the phone or even a separate machine. You can just get like a common little wall fan that you plug in for like $5, and it just point it to the corner, and it provides great white noise. So those are some very simple places to start. I think beyond that takes a little bit more delving into, but gathering data, that's some of the most helpful stuff we can get.
Those are some excellent tips, Dr. Chen. Thank you very much. I will, at the end of this, we have a resource slide, and we'll share a pediatric sleep log that we use at Seattle Children's, which could be a good thing, to keep your diary on. You can do a piece of paper as well, too. It doesn't have to be fancy, but kind of a way to think about listing it out by hour and that kind of thing. So yes, I'm so glad you guys, you're sharing all of that. And let's see, I think next we'll go to Sage, because Sage, I know as you've gotten older, you've still struggled with sleep. And I know some things that you shared about with me earlier, even your undergraduate degree was very kind of focused. You learned some things there in college that you've taken forward with you. So I'd love for you to talk about that, and then what you do now that helps you sleep.
Yeah, so I guess the first thing that was really helpful, especially like when I was high school age, was taking care of like mental health, as Dr. Chen said. So taking medication for depression and anxiety. If you're not having racing thoughts at night, you sleep a lot better. If you're, not experiencing depression, you sleep a lot better. And so just that alone did help. And taking melatonin, I've been taking it for years, and for me, it's been really helpful in being able to get to sleep. And then my undergraduate degree is in psychology, and so I took advantage of the classes where we were able to learn about things like sleep hygiene and CBT, insomnia. And so I took, all the advice about like getting rid of the electronic clock in your room so that you're not like counting the minutes when you have insomnia, and being able to take some of the cognitive reframing from CBT and kind of therapize myself a little bit without having to do the full program or do anything official, but being able to just take those little tips for me was really, really helpful. And recognizing sensory needs. So like I realized I need a weighted blanket to sleep. I need a room that's colder beyond what other people even need for cold. So investing in a fan, and like for me, having like earplugs and an eye mask is super important for being able to sleep. So paying attention to like what are your sensory needs as well is huge.
Sage, you just said so many things there. So I want to call out some of those things. And the very first one was about your own mental health, right? And so when you have those thoughts that are just cycling over and over and being able to turn it off so you can fall asleep, like that sounds like that was probably huge, like making sure your anxiety is in check. Yeah.
Yeah. And like, especially like I said in high school, like I was waking up hourly at night from just like anxiety. And so, then you go to school and you're super tired and everything sucks. So being able to not wake up hourly, I was like, wow, my life is a lot better.
And so probably in high school, is that when you maybe started the medication for anxiety? Is that?
Yeah.
Did you do anything else then in high school also for that anxiety, or was it primarily just the meds?
Also like talk therapy. I'm a social work student, so I'm a proponent of talk therapy, but also it was personally helpful.
Yeah. So, it's interesting. I usually give only a little bit of credit to my psychology colleagues. And I'll say, the one thing that they have evidence proving they're good at is kind of helping to rewire the brain when you have anxiety. And so psychologists can actually treat insomnia sometimes just with talk therapy. So no medications at all, huh?
Yeah. Like learning about the fact that, if medication isn't something you feel comfortable with, it isn't something accessible, like there are things that you can do, lifestyle changes and just changing the way that you think about things that can be really helpful.
That is awesome. And then also you were saying too, that you take melatonin and you've taken it for years. A lot of people will ask me like, is it okay to how long can I take this for? And so it sounds like it's something you've used for many years.
Yeah, I'm not a doctor, but I've been taking it for like 10 years and I'm still alive. So
I think melatonin in this country is considered a supplement. And so if you are comfortable taking over-the-counter vitamins, it's in that category. In other countries, it's prescription. And so there are other countries, but including this country, where we've done longer-term studies on melatonin. And I think the ones that are coming out really are very reassuring that, especially when you weigh the benefit of having gotten better sleep for 10 years and what that translates into, not just physical health, but mental health and all the things that are related to that, that tends to really outweigh any possible risks that are proving to be fairly low and not really of concern, I think, when we talk about the doses that we use for sleep in children with autism.
Excellent. Yeah. And Khadija, I know you've also experimented a bit with medications as well, too. Do you mind sharing those? I think we said them earlier. Yeah. Is it melatonin and triazidone?
Yeah.
And have those medications been helpful now? Does Samia still take those? Like, how has that been for you?
Samia take now, I think it's 7 to 8 years, and it helped her a lot. What I think helped her, Samia, is like bedtime has to be quiet and has to be cold.
Yeah.
So what I do, like when she eating dinner and getting ready, I open her room, the window. Even if outside temperature is too cold, has to be that room too cold. And she doesn't like if the fan. I had a fan at home, like she doesn't like the noise the fan make. So what I do, I just open the window when she's doing her routine. the room become cold, and I close the window. So two things worth working for her is like has to be cold when she sleep, and it doesn't have a noise. So has the TV has to be off when she go to bed, no electronic on.
Excellent. What do you guys do in the summer? Do you have a way to cool it down in the summer, or is that harder?
Summer we have we live apartment, so it doesn't have air condition.
Yeah.
But I have like it's not it's air condition, so I put that in the summertime.
Okay.
But wintertime, I just open the window a little bit. It got cold. Her room will never turn on the heat. So it has to be summer, winter has to be off all the time.
Excellent.
Oh, I never turn on her room in the wintertime heat. So like it has to be cold. If it's not cold, she'll complain it. Like say, this is too hot, I can't sleep. I make sure the room's cold. So if his room is cold, she take medication, and put her machine up. Her machine is as good. So definitely the melatonin and the other medication help her a lot.
Just to fall asleep.
Try to fall asleep and stay asleep.
Stay asleep. Excellent.
Yeah. Though I'm struggling, and until now they don't know why. She has when she sleep nighttime, her legs like she move a lot. So the doctor say maybe that's why her iron is low, but she taking iron now like almost in a year, and it's not bad. It was her iron before, but still she has the struggling, like she move a lot. So, but she sleep. She move around, but she sleep.
Right. I remember you sharing that with me. And so, Dr. Chen, I was thinking maybe you could talk to us a little bit about those legs at night, like restless legs, and what families might see and notice and do.
Yeah, there's sort of three. It's a cluster of disorders that movements during sleep that kind of fall under this restless sleep category. The first one is restless leg syndrome. That one is where people who have it have this insatiable urge to move their legs. They have very uncomfortable legs before they fall asleep, usually, though. This is an awake problem. Restless leg syndrome happens during wake. Some people with restless legs then go on to continually kick through the night. And these aren't like little kicks. They're very small. They're not like whopping movements, but little kicks. And those are called periodic limb movements of sleep. And those can disrupt sleep as well. And, once your sleep is disrupted and your legs are still moving, which we'll get to in a second, that obviously can then manifest in a whole lot of dysfunction the next day. In little kids, that dysfunction tends to be hyperactivity, impulsivity, poor emotional sort of like ability to rein it in type of thing. And in older teenagers, it starts to become just plain old sleepiness, or poor decision making, poor judgment, those sorts of things. The last disorder in that cluster is a new one that's called restless sleep disorder. And that's where kids, it's not just little kicks. I mean, these kids are doing 360s in beds. The blankets are on the ground. They're on the ground sometimes. And it happens pretty frequently. And all three of these disorders seem to be related to iron stores in our body. And so that is why I'm assuming, Khadija, that that Samia's provider prescribed some iron to help get those iron levels up to see if the movements would settle down a little bit. So we're learning a lot about those movement disorders now. We don't know if they are more common in children with autism, but there are a lot of people who think that we have likely been misdiagnosing or missing the diagnosis altogether in children with autism. A lot of it is because they have different sensory experiences to begin with. And so some of those classic cues that we're looking for in kids who have restless legs, like they describe to us this need to move, or they feel like they have bugs crawling on their legs or something like that. There are children with autism who have those sensations regardless, or who have sort of the need to do a lot of repetitive movements that has nothing to do with restless legs. And so I think there's been some kids who have gotten missed in that sense, but we're learning, and we know that iron can be a very effective treatment in that sense, but it just takes a long time to get those iron levels back up.
Well, thank you, Dr. Chen. I actually learned a bit there too. I didn't realize those 3 subcategories. This is really good information. Thanks for sharing that. I did want to go back to Sage for a moment here, because I've been thinking about sleep, and especially individuals with autism. And there are definitely some people who are more like night people. And so part of the hard time going to sleep is because they're kind of a night person. And Sage, I remember you telling me you had a job that kind of like fit well. Do you want to talk a little bit about that? Share that?
Yeah, last year I had a job where I was working the swing shifts. It was 4 p.m. to 12 p.m., which I actually really enjoyed the schedule, because for me, I'm awake during that time anyway, usually, or like I would be. And so for me, having a job where I could sleep in late in the morning and then be more active at night, which is just kind of what my body seems to want to do more, would have been great, except for I had classes in school that didn't work out. But the working at night part, I realized that was actually something that felt good for me, to just kind of lean into the reverse schedule.
So it's like going with the flow instead of fighting it, huh?
Yeah, exactly.
And Dr. Chen, this is kind of a surprise question, but I've been surprised in that from our participants tonight, I kind of sent some things we might end up talking about, so everybody was prepared. But my understanding is that there are different kind of like, I think they use maybe chronos or like sleep type like person. You want to talk a little bit about that?
Yeah. So everybody has something called a circadian rhythm, and that is a rhythm that helps to dictate when we are awake, when we are asleep, and all the functions that occur during that time. For instance, when you're supposed to be asleep, your body is not supposed to be necessarily eating food. So just think of it that way, like all these things that sort of go together in that sense. There are definitely people who are more awake in the nighttime owls. Classic night owls. Fancy name for it is something called delayed sleep phase syndrome. And we know to some extent, teenagers, just as they are going through puberty, they become relative night owls to where they were. And then when they reach their mid-20s or so, some of them sort of move back a little bit more towards more morning personalities, or what we call chronotypes. And then there are people who are morning larks who, no matter what, prefer and seem to do best and prefer to work in the early morning hours. Sage, what you were saying about being able to roll with it, that's actually such a huge part of treatment for delayed sleep phase syndrome people, or night owl people, is to find something that works with your body type. And in adolescents and even young adults, one thing that we've really tried to do is to move school times and classes so that they start a little bit later, so that kids can sleep in and sort of work with their biology instead of fighting it. Because for a lot of adolescents and young adults, asking them to go to a 7 or 8 a.m. class, which is when all the big classes seem to happen, it's kind of like the equivalent of asking an adult to get up at like 3 or 4 in the morning and actually be functional. It's like, of course they're not learning at that point in time, and they're going to miss classes, and it's, and we're asking them to drive a lot of times to get to those classes, if they are still, like, for instance, in high school or commuting. So there's a lot of work I think our society needs to do to sort of embrace some of those different types. But I would say certainly for my patients, those who are night owls, they love college. They love being able to pick just afternoon classes. They love being able to find those swing shift jobs and things like that. So I applaud you for being able to just recognize that about yourself, Sage, because it's a big thing, and it's something where if you can find a job for that flexibility, it oftentimes tends to be a win-win situation. Like, employers want people who want to work those hours. People are needed during that time, and not everybody wants them. But if you do, go for it. I mean, it's the better thing for your body, to be honest.
That is awesome. Thanks for just off. I'm sure you could probably talk for an hour straight about all different sleep things, because it's clearly your passion and something you know a lot about.
Well, I think just evidence from this conversation. I mean, when people don't sleep, it's not just the individual, right? But it is the entire household. It's everybody that you touch in your life, in the sense of like, why wouldn't we all want to put our best foot forward in that sense? And sleep is just one of those fundamental things. Like, we don't feed, we try not to feed our kids like absolute crap on a day in, day out basis. But for kids who have sleep issues, that's kind of what happens to their sleep neurons and things like that. They just are not healthy in that sense. And so prioritizing sleep for the entire household is something that is really, I'm very passionate about. I think it helps a lot of people.
Excellent. No, I think you summed it up perfectly there. Sleep impacts everything and everyone in the whole family. And I am curious if you have advice. A lot of times thinking about how long sleep onset should take. So when someone lays down and they're having a hard time falling asleep, like, about how long should it take? And if it's taking more than that, do you have some ideas on maybe what they should do?
Yeah. It's an incredibly subjective thing. So type A personality, so people who are very, very into efficiency and being organized, get really irritated if they are in bed and awake longer than like 5 or 10 minutes. They really want to be able to hit that pillow and just be out, because anything but is sort of a waste of time. And that escalation of getting irritated with yourself actually just prolongs the amount of time that it takes to fall asleep. So I think for most children, being asleep within 20 to 30 minutes of when the door closes and the lights are out is what we would consider reasonable. But what parents feel is normal versus what the textbooks say is normal in a sleep lab setting oftentimes are very different things. And so for example, medical studies, like these big studies that say, oh, look, this helped with insomnia, and we reduced the amount of time it takes to sleep from 50 minutes down to 30 minutes. There's a whole lot of people in that 30-minute category that are still very unhappy with how long it takes them to fall asleep. And so that's really individual and personalized in that sense. What I would say is, if you feel that your child or yourself is just escalating with that frustration of not being able to fall asleep, don't just lie there and continue to try at it. You're just going to fail more. Really, if you know it's not going to happen, get out of bed and just hit the reset button. Go somewhere else, do something that is very low key, not all that stimulating, not with bright lights, ideally not on screens. And, so color in a coloring book, or do, simple crossword puzzles, or, just have a lovely conversation in a non-escalated manner with other people in the household. But don't just lie there and continue to fail at it. That failure just perpetuates more failure in that sense.
Thank you. Another great response off the cuff, which is so great. Sage, I was wondering if you had any other tidbits, information you'd like to share, anything come to mind for you, for those listening, advice you'd give, or I know when you were in your undergraduate in psychology, like your focus, sleep was something you learned a lot about, and learned some good hygiene techniques while you were in school that you carried forward. And just any advice or any tips that you would want to share?
Yeah, I think kind of echoing what Dr. Chen is saying, like, if something's not working and then you keep thinking about how it's not working and then you get more frustrated, it's going to keep not working. And kind of taking that mindset of being really kind with yourself. If you're not able to sleep, it can be really easy to be like, what's wrong with me? Like, why can't I sleep? It's a normal human function. And so not like going into those thoughts as much as you can, and kind of resisting that urge to blame yourself. And when you're trying sleep hygiene things, like I won't lie, I use my phone in bed, even though I know, it's better not to. But rather than beating myself up for it, I'm like, okay, well, I'm just gonna not use TikTok after 8 p.m. because it's not good for my brain. And so making, even if I'm like, I'm gonna use my phone, being willing to make smaller concessions, but I won't use TikTok, and instead I'm just gonna read. So as much as possible, trying to get away from an all or nothing mindset of I have to, not have my phone, and if I mess up once, I'll never try it again. Let yourself fail, let yourself take small steps towards what you're trying to get to, and it'll feel a lot better and work a lot better.
That is excellent, Sage. I will say too, reading at night helps me. It's kind of almost like a sleep tablet. If the garden imagery isn't working, I usually pull up the New York Times, and at some point there, I can only go so far, and then I'm like, so that was great advice, Sage. And I especially love the giving yourself some grace comment. I think that's very powerful. Great thing to add. Khadija, do you have any parting or advice you'd give to parents listening tonight, either for themselves or for their kids? You've shared a lot. So if you've shared what you shared, I think it's wonderful and right on. I will say, I know you had also told me kind of through this process, you realized that you were also having obstructive sleep apnea.
Yeah. I diagnosed this year.
All right.
Yeah. So.
Do you also use the CPAP now?
Yes.
Yeah. So
yes.
Now you can feel what Samia was feeling.
Yeah. And I was some of them, I don't have autism, but it was hard to me even to get used to first a couple of weeks. Middle of the night, I just take it off, and I didn't even know. I take it off, and I see in the morning, I don't wear in it.
Right.
But it was challenging, and it worked, and I get help. Usually in the morning, I go to sleep, and I feel tired. I wake up headache, and I didn't know all that thing come with the sleep apnea. So since I start the machine, I get better a lot. Even my brain is function before, I forgetting stuff, I irritated easily, yeah. So it is hard when your brain, it doesn't sleep in nighttime and just keep going all 24 hours. Yeah, it is hard. And the parents has autistic children. It's challenging in life. And be patient. That's my advice. Be patient. I know it's hard. People, the doctors and people in medical field, they understand, but a lot of people, they don't understand. When you get to run daily life, I have four children. So yes, Amia, she's the youngest. But I have 3 adult children, and I'm glad they're here and helping me now. But they wasn't that older than her when they're young, and I didn't have help, and I didn't have a lot of knowledge. One Samia diagnosed for autism, she was 2 years old. And when I got to the doctors and they told me, and I was like, now I get it, what's wrong with her. Now we get the medication. She's getting better. As soon they say it's not medication, after that, I didn't hear nothing else the doctor say. Nothing. I was no medication. My daughter, she's like this forever, because I never heard before. I never see any children have it. I never heard before my daughter. So I'm so glad that the team of Dr. Samia has, they helping me a lot. And I thank you for that. So when they told me, the doctor told me, it doesn't have medication, but if you help Samia now what she needed in her adult life, maybe a lot of people, they didn't know what she have. She's gonna be normal children. normal kid. So I was like, okay. I mean, second day I go to my job and I say, I want to work part-time. I can't do full-time anymore. So he gave me a big book. They told me, okay, you start here, then you're gonna get help. So if I go to school at nighttime and listen to sign classes so I can learn what the autism it is, how can I get help? What I can do better than my daughter. And that all effort, it worked. It helped her along the way. Not only her, but it helped me too. So I understand what it was. So if in our community, if I see some family, I told them, you have to understand first. You help your children if you don't understand what it is. You have to have more knowledge. What is autism? What are the kids, like you have to keep deep in understanding. So it's challenging, and you need a patience and knowledge. Like you have to understand. And more you understand, more you help your kid. So I'm glad I did that.
Yes.
My daughter, she got a lot of benefit for that. Like anything she can get help, I take her. I remember I have 2 days off, and that's Wednesday and Thursday. And those 2 days, she has in the morning in therapy, afternoon in swimming. Like I make all her appointments those 2 days. And if I didn't do it when she's that age, then I know she can get help when she gets older.
Yeah.
So I try, and she got a lot of benefit for that. It's hard time. It's a lot, and it's not easy. But you see the result if you do all that work. I'm telling them, all the families, like patient, you're gonna see them later. But it's a hard time, but you have to do it to see the result. Autism, it doesn't go anywhere. It's there, but the kid is they know more knowledge and more. Sania now when she with me, when new people, they don't know what she's like. She's autistic. She doesn't. Even some words she used, my 27-year-old son, he doesn't know. And they shock when they say, huh? If anything wrong in the electronic in the house, they call her and she fix it in a minute. And I told them, you guys go to college, but you're gonna ask her, send me a help, and say, she's genius.
I think one thing that you brought up that was so important is the need for patience and the need for parent advocacy. And
Yes.
I will just say those are both very hard to do if the caregiver, if the guardian, if the parent is completely drained. And so the fact that you took it upon yourself to get yourself help and get your sleep better. I have so many families who come in who just say, if I could only sleep, I could deal with everything that happens during the day so much better. And it's just true. Like everybody's fuse is just shorter when you don't sleep. Your ability to organize everything on Wednesday and Thursdays like that kind of goes out the window if you're not sleeping, right? Because you don't remember things. Your organizational skills, your executive function just sort of goes away a little bit when you're completely underslept. So good for you. But it's also an incredible illustration on how much our guardians and our parents need to help themselves too.
Yeah, I agree with you, doctor.
So well said. You slipped right in there, Dr. Chen, and summarized that in such a perfect way. I do want to pull up real quick. We do have a slide with some of those resources that we were putting in the chat, our sleep log, as well as some information about melatonin. I would also encourage you, if you're watching, to log into the Seattle Children's Autism Center and click on our resources link. If you scroll down there under Living with Autism, we have a link all about sleep with tons of tips on sleep hygiene and troubles with delayed sleep syndrome and all those kinds of things. So hopefully these resources will be helpful for you. You can scan the QR code or click on the link in the chat. Let's bring our participants back up so we can say goodbye. Oh, there's me and the other. Yes, excellent. I want to thank you all so much for your time tonight and for sharing your stories, sharing your knowledge. And I know this is going to be an excellent resource that families are going to really benefit from. Advocates themselves, hearing your stories, learning this knowledge. I want to thank you all and say good night.
Good night. Thank you so much for having us.
Thank you.
Good night.
Good night.